Welcome to episode 9 of Dr Hatz vlog. This is the second in our mini-series that is focusing on our work with innovators and supporting them to navigate the complex health and care landscape. In this episode, I spent time with Rachael Grimaldi. Rachael is a clinical professional, but also the CEO and co-founder of CardMedic, a healthcare language app supporting clinical interactions where language barriers occur. Rachael, thanks for coming down to the University of Surrey. Tell us a little bit about yourself and CardMedic.
So it's an app that hosts a library of scripts that replicate common interactions between staff and patients, all of which have been written by frontline healthcare staff and allied healthcare professionals. And you can change those to 50 languages, sign language videos, easy read or read aloud. We also have an integrated live chat tool, and now we're at a really exciting point in time where we are integrating live human interpreters as well.
You're also an NHS clinical entrepreneur and an IA fellow. Tell us a little bit about what that journey has been like and what some of the challenges have been.
All of those networks have been absolutely phenomenal. I was a clinician with no business experience at all, and it took me from that person into very much learning a new language, understanding financial modelling, business cases, pitch decks, presentations, health economics, and so on.
In my vlogs, I am a big fan of thinking about how we can leverage AI and data to transform healthcare. And I'm aware that you've secured some grant funding of nearly £1 million to support some work in AI with CardMedic. Tell us a little bit about that.
Yeah, it's been a really exciting few months for us. So yeah, we secured nearly £1 million in SBRI and Innovate UK grant funding. And this is really to help us in the next stage of our journey with integrating human interpreters. So it's very much ensuring that our platform is AI enabled, but we always have humans at the centre of this, because fundamentally our app is all about reducing health inequalities from communication barriers between staff and patients. So that is very much where we sit, is in that space where humans are communicating with humans. But it's really important to recognise AI and the role that has in enabling those technologies to scale.
Our team has been working with you for a while now. Our enterprise and industry team is made up of innovation managers, coordinators that support innovators to navigate the health and care market and navigate the NHS, which is a complex beast. Tell us a little bit about what that relationship's been like and the support you've had from Health Innovation Kent Surrey Sussex.
It's been very much from the beginning. So when we first launched, as I mentioned, it was sort of 72 hours from concept to launch. We very quickly then joined the Hill and then the NHS Clinical Entrepreneur Programme, and in that space of time we also got an Innovate UK grant, and it was the first grant I'd ever applied for, and I knew absolutely nothing about how to go about it, and just again through the power of the network got introduced to the team in KSS, and they were invaluable at providing direct feedback as to the grant application, but also introducing me to people who'd previously been assessors for Innovate UK who could provide some insights and some support. So I think it's been a variety of practical advice around the funding, doing the evaluation, mentorship, thinking about health economics. There's been loads of different areas, and we've got a really strong relationship with the Health Innovation Network for Kent Surrey Sussex, and it's definitely provided us with some really invaluable insights through our journey.
Really pleased to hear, and it's great to see you thrive. I'm excited for what comes next, and inevitably this is going to go from strength to strength. Thanks so much for joining me today.
Oh, thank you.
Massive insight into the work that you're doing, and wishing you all the best for the future of CardMedic.
Thank you for having me.
It was great to speak to Rachael about her work navigating the health and care system and how our innovator team has supported them. And no doubt they are part of the future in terms of how we manage services and interactions with patients. I hope you enjoyed this episode. As always, give us some feedback, and if you are keen to work with our enterprise and industry team, I will include the company engagement form with this video.